Good morning. My name is Darren Goss, and as most of you know, I think I am the president and CEO of the Coastal Community Foundation. And I'd just like to welcome you here this morning for one session in a series of educational events that we'll be having over the next several months. And this morning, the topic is how local nonprofits are navigating the pandemic. And we have a Blue Star panel of nonprofit leaders that will provide some insight, so probably some humor, as I see Lily Coleman, and certainly provide a lot of perspective that I think will be helpful to us as a community and to you as donors and fund holders for the Community Foundation. So thank you for being on the call this morning. Like to absolutely thank our sponsors, Blackbaud, and many others who are responsible for putting this on. Let me introduce to you Melissa Levesque, our Vice President for Development and Stewardship, who will kick us off, facilitate the panel discussion, and navigate this process for us this morning. So Melissa, thank you.
Great, thank you so much. And again, we're very appreciative of Blackbaud and those who make these programs possible, including our donors who we're thrilled to see here today. I wanted to start with a couple of housekeeping items. We want this to be very engaging for our donors to ask questions. And I want to highlight that we've received some questions in advance, but if you have questions that come up during the presentation, please type them in the chat box. So if you see GoToWebinar has a control panel at the very bottom, the last highlight will be chat. And if you just click on the down arrow, that will open up a text box, and we'll be monitoring that. So look forward to your comments. And with that, we're going to go ahead and get started. Thank you. One reminder very quickly is on Tuesday, November 10th, we're going to have our philanthropic engagement series. That's also part of our partnership with Blackbaud. Our program is going to focus on eviction in South Carolina, so we want to make sure that you mark your calendars. You'll be getting emails about this as well, but we want you to mark it because we're really focused on providing great content for you throughout this year. All right, and we'll go to the next slide. One of the reasons why we wanted to have this program is in response to what we're hearing from our donors and candidly the whole public is the pandemic has created tremendous stresses and needs on our entire economic system, but we're very much feeling it in the nonprofit sector as well, especially along the coast. And some of the areas where we're seeing it very specifically, and this is from the Center for Disaster Philanthropy, is certainly in human service and healthcare needs. We're seeing larger population needing these services, and it really spans everything from digital equity, mental health, income and basic needs, homelessness, medical needs, social justice. But in addition to human service and healthcare needs, we're also seeing some of these same needs in other nonprofits that serve our communities very robustly throughout the year. For example, with arts and culture and our other nonprofits, as the pandemic is continuing, dropping attendance for museums and our other cultural institutions are negatively affecting their operating budgets. A lot of their income comes from attendance and fees, and when you can't open or you have limited space to have visitors, that's going to affect your bottom line. Additionally, supplemental cultural and education programs for children and youth where sometimes everything can't be done virtually. Many groups have done a terrific job using 2020, I think, word of the year pivot to make sure that we're being responsive to the needs of everyone we're serving. But in some areas, it's a little bit more difficult to make that transition. In looking at charitable giving needs, we wanted to provide some information that's pretty much hot off the presses from some surveys. Recently, the Riley Center and Together SC did a survey and released information about COVID-19 and the status of South Carolina's fundraising sector. The sample was 566 respondents, and Coastal Community Foundation and Waccamaw Community Foundation were very pleased to provide information to help with this. Diverse in location, number of staff, annual budget, but the numbers are pretty staggering. 63% of the nonprofits reported they can only survive 6 months or fewer without additional funding. A lot of nonprofits that run well, they have operating reserves. It's not a lack of trying to have good financial stewardship. It's just those reserves are being used, and some of those groups are now really feeling the pinch, and others don't have a reserve at all. 76% are reporting a slight or significant decrease in funding, while about 16% are seeing a slight increase and 8% are seeing a significant increase. 20% of organizations have reported furloughing staff. Nonprofits are definitely making tough decisions on how to be good financial stewards while also responding and carrying out their mission at a time that it may be even more necessary than it has been previously. And finally, 93% have altered their program or service delivery methods. And that's something I think we're all experiencing. It's certainly this program, the fact that we're not all together in a meeting room is an example of that change. But nonprofits have been very flexible and have done a tremendous amount of work in making sure they're delivering their services in a way that is safe during this time. Earlier this year, shortly after March 13th, Coastal Community Foundation, Waccamaw Community Foundation, Francis P. Bunnell, and 7 other philanthropic partners along the coast funded the started the COVID-19 Relief and Recovery Fund and solicited contributions throughout the South Carolina coast. To date, we have distributed $1.1 million in grant funding, and this is entirely pass through. We do not take any administrative fees for the work that we do for this program specifically. And you can see the breakdown. It's pretty much equal throughout our 9 county service area, and about 12% are for organizations that cover the entire service area as well. And when we dig a little bit deeper, we can see, where's the money going thus far? Food and supplies are certainly high. That was primarily at the beginning, but we're certainly seeing those needs continue. And you can see here that we're trying to make sure we're addressing multiple needs right now. After highlighting those needs and a lot of the flexibility of what our nonprofits in the community are doing to be responsive and be great stewards serving our communities, the question is, what are some incentives to make sure we can have some charitable dollars flowing to them specifically? The CARES Act passed earlier this year had a lot of incentives for businesses as well as nonprofits. But one of the specific things that we'd like to highlight is there are 3 provisions that were meant to encourage charitable giving. The first is that non-itemizers can deduct up to $300 of charitable gifts as an above-the-line deduction. There was legislation that was introduced earlier to have that be $4,000 for individuals and $8,000 for married couples, but that has yet to pass. Additionally, gifts of cash this year only may be deductible up to 100% of someone's adjusted gross income rather than the normal limit of 60%. So that ceiling has been lifted to encourage charitable giving. For corporations, normally there's a 10% limitation on how much you can deduct. This year, that's 25%. So those are specific provisions in the CARES Act. One thing that we'd like to highlight and encourage for our donors as well as others is that currently markets still have a lot of appreciation for those who have investments in the stock market. And when the 2017 Tax Act was passed, many donors became familiar with the concept of bunching gifts, where you give a larger amount that might go into your donor advised fund, or it could be a gift that you're giving to a nonprofit specifically, where you're really taking advantage of that appreciation and you're looking to fund several years worth of your grant making. And that's certainly something that we encourage while markets are still high, because it's a way you can have that charitable nest egg to support organizations this year, but also for the next 12 to 24 months. And with that overview, I'd really like to just introduce our 4 panelists who are terrific. They do fantastic work in their communities, and candidly, they're representative of many groups that are doing great work where we live. So with that, I'm very excited and proud to introduce our panel. To start, I'll introduce Erica Plater. Erica is the executive director of Our Lady of Mercy Community Outreach, which is a 30-year-old nonprofit providing direct services, education, and health services to the rural Sea Islands of John, James, and Wadnala Islands, as well as downtown Charleston. Erica has a 25-year career that includes work in public education, healthcare, public health, philanthropy, and community development. She's a native Washingtonian and has degrees from the University of Maryland, University College, as well as Howard University. And we're very excited and happy to have her here to share what's going on at Our Lady of Mercy. Additionally, would like to introduce Kevin Mills. Kevin Mills is the president and CEO of the South Carolina Aquarium. In his 15-year tenure, he's done fantastic programming, and prior to assuming that role, he oversaw the $25 million initiative to make the aquarium happen. Prior to joining the aquarium, he was vice president of marketing and external affairs for the St. Louis Zoo, and he's really been an active leader in the museum and aquarium professional space for many years, serving on numerous boards, including the World Association of Zoos and Aquariums Advisory Committee. His prior experience before being with zoos and the aquarium goes back to the Museum of Modern Art in New York City. Lily Coleman has been the executive director of Second Helpings since 2017. Second Helpings is a nonprofit food rescue and distribution network that serves Beaufort, Jasper, and Hampton counties. And since she has begun, she has more than doubled the annual income of the organization through grant writing, and increasing individual donations. Lily is a certified crisis communicator and has more than 15 years experience in the communications and advertising areas as a communications director for a major chemical corporation, as well as president of an advertising agency. Prior to coming to Second Helpings, she was the executive director of the Bluffton Self-Help organization. Completing our panel is Joe Kunkel. Joe is the executive director for Neighbor to Neighbor of South Carolina, and since 2013, he's been bringing Uber to seniors in Horry and Georgetown County. The Neighbor to Neighbor program averages 8,000 free volunteer-based rides for homebound individuals, connecting them to services they need, including in reducing senior isolation. During the pandemic, they have implemented new safety protocols, they've transformed their model, and they've also been connecting seniors through virtual education as a program enhancement. Joe has been working with the senior population since he was in 3rd grade. And he's got terrific on-the-ground experience that he can share with us, as well as everybody on the panel. So at this point, what I'd like to do is give each of our panelists 3 to 5 minutes to introduce themselves in their own words and provide a snapshot of what you're seeing in your communities, and then we'll start with some questions and answers. So Erica, if you'd like to start.
Sure. Good morning, everyone. I'm really happy to be here, and I thank Melissa and the Coastal Community Foundation for the opportunity. I am a native Washingtonian, but I've come to love and enjoy Charleston, South Carolina over the last 4 years I've lived here, and the 3 years I've been executive director of Our Lady of Mercy Community Outreach. It's an interesting time to be here and to see everything that's happening with COVID. In our communities in particular, we are definitely seeing increases in needs for food, for clothing, for financial assistance, and unemployment or employment needs. On top of already having communities that are struggling with basic needs in general, even before COVID. And so this has added another layer of challenges for them, especially in rural communities that we serve and also in the urban communities of downtown Charleston. So we have had to ramp up a lot of our efforts to help our community, and our larger community in the Charleston area has actually done a phenomenal job of stepping up to help during this crazy time as well. So I look forward to sharing everything that we've been through and everything we've learned as part of the process.
Terrific. Thank you. Kevin?
Good morning, Melissa, Darren, thank you for having the aquarium join this group this morning. And I'll say, first of all, we're celebrating our 20th anniversary at the aquarium with impeccable timing. We entered 2020 in a celebratory mood and coming off some strong attendance years and with a new strategic plan in place that we intended to begin to commission this year, which included expanding our educational programs and deepening our conservation footprint. Of course, that all changed with the outset of the pandemic. And when you think about the aquarium, our mission is really like a three-legged stool. We do have that leg that is the education offerings that we provide, our STEM programming here in our classrooms, our outreach across the state, and our distance learning programs here and literally around the world. Our second leg is our animal care and our conservation programs, and we care actively for more than 5,000 animals under our roof. And that care is not just biology, but it's all the life support systems that maintain their health and vitality. We also rehabilitate, as probably many of you know, sea turtles that are injured or sick and washed ashore, and we return them back out to sea. And then our field work extends to help save populations in the wild, endangered species, both on land and shore and even in the air. The third leg is the one that I think most people probably appreciate most and have experienced, and that's our guest proposition. And we are a paid attraction. And so when COVID broke, that third leg basically snapped off. We were closed for more than 2 months, and yet our animal care had to continue. And our education programming was still in great demand from the schools that we serve and the families that we offer to. So we pivoted, there's that word, very quickly to ensure that all of our offerings were available virtually through streaming video. But that third leg being off and now only shorter than it used to be continues to hamstring us. So we had to figure out how to quickly retool and make the aquarium accessible to our guests in a safe way and also safeguarding our team, creating social distancing, ensuring mask requirements, eliminating pinch points in the aquarium, and reducing our capacity. Melissa, as you said, many attendance organizations have had to cap the numbers of guests that come through, and for us, that's 25% of our full capacity. So we're really working upside down against our revenue. Typically, 80% of our annual budget comes from the folks that walk through our door, and 20% sustains through fundraising our ability to do education and our conservation efforts. And as a result, we're looking at a shortfall right now this year of about $5 million out of a $12 million budget. So not quite 50% is a lot to tackle, and we've made some tough choices along the way. We've had to reduce or temporarily suspend programs like our sustainable seafood program, scale of our education programs. And we've gone through some painful waves of furloughs and then successive rounds of layoffs, and have effectively reduced our workforce by 25%. And these include very talented, dedicated folks that are committed to our mission. So painful time for our team. Our board stepped up. They stepped up early, and they stepped up again recently as we've begun to redirect our fundraising directly to the public. And we're doing fundraising in ways that we never imagined before. Typically, you do a quiet campaign and then you top off at the end with a public appeal. And we went straight to public appeal because the clock's ticking. So we feel fortunate to be here. We're confident we're going to survive, but we're concerned about recovery and what that looks like on the other side. And we want to make sure we contain the core elements of our programming that we have in place, and our very talented team members that are making this mission come to life. So thank you again.
Absolutely. Thank you. Sobering information. Joe, I'd love to hear about you and your work.
Well, thank you so much for this opportunity. Good morning, everybody. I want to take you on a quick journey back to March 13th. I was living in the Disney World mode. no news, no real phone usage, because my wife actually won a trip for us and my in-laws to go down through her work. And as our trip was ending, as we were driving through Georgia, turned on my work phone, and I was just bombarded with messages and voicemails to check the news. And so that was when I first heard about the national emergency. So I went right from free love and Disney mode right into work focus mode. And so Neighbor to Neighbor, we're an award-winning volunteer transportation model, and we're designed to provide a person-centered approach to mobility access across Horry and Georgetown counties. And boy, did COVID-19 fundamentally disrupt this program. So almost instantaneously, I was on the phone with staff and board members, strategize our response, and I had staff review the CDC website as a guide for how we're going to respond, because even then there was a lot of mis and bad information out there. So staff came up with a plan Sunday to contact every client and volunteer in our database, so there was over 2,000 individuals, to begin an initial screening process, engagement process, and really for initial things to keep in mind as we all navigate this new virus. Simultaneously, Board of Directors had an emergency meeting on Sunday to put into place a required PPE for all rides. All of our drivers have to go through a specialized COVID-19 training and to notify all riders about our new PPE requirements. So we felt that with all this information here, we were kind of lost because we had to re-engineer our model. No one had rules on how to proceed about this. So we took best practices and our own information to put together to keep safety as our top priority. We knew that seniors were most vulnerable to this virus, and that's the population that we primarily serve. So requiring the mask, hand sanitizer, gloves, coughing training, implementing a questionnaire before all rides, and then validated the PPE was used on every trip from the rider and volunteer. And that went into place Monday morning at 9 o'clock. So that was a pretty long weekend. And so our initial thing, right when we picked up the phones, more than 50% of our volunteer base dropped off like that. As we talked to folks, we explained our new procedures and safety protocols, but a lot of folks were unwilling to do it. Even the doctor's offices locally were not prepared and provided very little guidance on how to proceed. We had a significant loss of grant funding almost immediately, as well as our fundraiser. And so for us, we lost approximately $120,000, which is 1/3 of our budget, just like that. And everything just seemed to happen so quickly. And so the sheer amount of PPE supplies that are required for us on a daily basis, those dried up very quickly. But thankfully, we were so proactive in the beginning to prepare our trainings and materials that we did have a surplus of supplies to work with initially. And so things got more complicated. It became clear that our destinations, like grocery stores, for example, weren't following mask protocols, weren't practicing social distancing, were not advocating PPE even at the employee level. So we had to actually add a destination validation for every single ride request. So adding to an already working staff, additional elements that make sure that, again, safety is #1 priority. So we worked with our developer. We used a software system to coordinate all of our rides, and we developed a wellness call component, a pantry route delivery program, and added fields for PPE tracking for reporting purposes and to make sure compliance reasons with our policy. And so this was widely embraced by the developer and actually is now part of the nationwide system that they have in place across the United States. And so for our emergency funding, there was just such a need in the very beginning, and we did receive a small grant to help us out. And really the cost to offset the expenses, it doesn't really compare to the true cost of converting our programs. First for the safety protocols of our transportation, and second, refocusing around engagement versus transportation by providing adult education, wellness phone calls, and food pantry deliveries. And so we all got a taste this year of what isolation means in your own home. And it's been tough on all of us. I can only hope that it's really raised awareness and empathy for our homebound seniors, many who have been living in isolation for years. And this has been part of Neighbor to Neighbor's mission for a very long time. But the pandemic really allowed us to bring a new energy to this problem, focusing on it from new angles. And at the core of all this, our new programs still central to everything we do are our volunteers. and creative ways that we can re-engage and activate those who wanted to help but not comfortable doing the traditional rides that we're known for. So we started an adult education program called SALT, Senior Adventures in Learning and Travel. And at the height of COVID cases in Horry County, CCU, Coastal Carolina University, cut its OLLI program, just entirely cut the program. So hundreds of seniors, many of whom relied on this program to interact and engage with one another, lost the opportunity when it was needed most. So my board vice president met with the former OLLI program directors. Long story short, we developed an online virtual learning system in less than 5 weeks, offering 152 active classes and enrolled over 300 students, and provided the technical assistance required to help folks stay connected when it mattered most. And I don't think I've slept since March. So, and I just wanted to finally let you know about our wellness calls, that we're using this to make sure that we're streamlining service and access for our folks, and as well as a food pantry, activating 6 active food pantries with formalized MOUs, and making sure that we understand that the pandemic really does connect us in ways, because it really is a small world after all. Yes, I did go there with a Disney reference. So
everything comes full circle. Thank you so much. Lily, would love to hear about what you're doing with Second Helpings.
Well, first I want to thank you, and I feel so honored to be part of this panel. I'm very, very impressed by the talent and the actions that have gone on. Second Helpings covers 3 counties, and we have 55 agencies, and we had 340 volunteers. So early February, I started researching, I heard it coming, and found a program that was done in Oklahoma. And then at the first board meeting in February, advised our board that we should create a task force, and they were right on it. So we created a task force right away to see how we would handle the pandemic and how we would operate going forward. So my board has been very involved from the very beginning, and so have my agencies. We also got involved in any oath that was involved with safety procedures. We lost about, I'd say 70% of our volunteers. We have 8 refrigerator trucks. We pick up food every day and deliver it to agencies that are having distribution that day or the next day. So we had to orchestrate closings of agencies, a minimum volunteer staff. We were very fortunate, Coastal Community Foundation and a number of other funders came forward with COVID money. Of course, right away there was a shortage of food because everybody was buying food in panic. So we had to purchase food as well. So we reached out and created vendors with US Foods and Ordens and other organizations so that we could make sure that our agencies continue to get food. We right away had our volunteers sign an oath, safety oath. That's been a little bit of a challenge to get them to wear their mask and do what they're supposed to, but we made them sign an oath, and they all signed it, and that was really important. We also wanted to make sure that there wasn't a lot of times the agency is saying, oh, well, I know there's an issue over here with food. So they kind of had some mission drift going on. So we had to manage that, where one agency wasn't mad at another agency because they were doing their job. But they were all being operated by volunteers. So they were scarce and they had small staff. So our volunteers normally don't unload the truck, but they were doing that as well. In the middle of this in Hampton County, we had a tornado that went through. So right away, we had to try to supplement that and get them food as quickly as possible. We are very fortunate because we were one of the key charity causes that people wanted to support. So we had lots of money coming in, and we had a lot of restricted money coming in. So we had to make sure that we're managing that funds and buying food for their areas. So some grants say Beaufort County, some grants say Hampton County, some grants say Jasper County. So we have to manage that, make sure that the reports are reflecting where we're spending the money. We're seeing some national programs coming into our area that are saying that we can only give out food in Beaufort County because they haven't recognized Hampton and Jasper County as counties of need. And that's been puzzling for me to figure out why they're not recognizing that there's a lot of poverty out there in Hampton and Jasper County, and giving all the food to Beaufort County. So I'm trying to manage all that. I have to thank my agencies. They've been amazing. They keep us informed. If right away, if somebody was positive, tested positive, we had to make sure that we didn't go to those agencies, and we worked with them to reopen. So we also have a program, Healthy Foods, and we work with a farmer out in St. Helena, and that operation continued. We were able to pick up that produce and get it out to our agencies. And our most current new program is working with children, and they are our food rescuers. They rescue food at the lunch, milk cartons, the fruit cups, all that gets thrown away. We're rescuing that. And of course, that program has stopped until schools are in full operation again. So I really have to extend a thank you to my board, my volunteers, and my agencies. 30%, we did do a survey and found out that our agencies had an increase of at least 30%, every agency, of people who needed food. And then we are also in the middle of an organizational audit. The board is interviewing our agencies, our food donors, Low Country Food Bank, who's we work with, and finding out how we can improve our services going forward. So we're being very proactive. We're looking at technology, and we're just changing. Every day is a new surprise.
Sure. Every day is a new surprise. I think we're all experiencing that. One thing I'd like to do is just start with some broader questions. All of you have touched on some significant issues that we're hearing about in terms of how much volunteer support is critical to the work that you do, and how those volunteer resources in some instances are going down, as well as ancillary fee revenue. One of the things that I'd really like to find out from each of you, and I'd like to start with Erica, is what's been your biggest challenge in the past 6 months? But also, I'd love to know what's one of the biggest surprises in a positive sense that you've seen in some of the work that you're doing.
Well, for us, when COVID first hit, we really had to pivot and close all of our programming except for our basic needs, which is really the food, financial, and unemployment assistance. And so the biggest challenge we had was really around staffing. Many of our volunteers at that point had opted to stay home and to protect themselves and stay safe. We really dropped at least 50% around our volunteer capacity. Staff too, we lost some staff in the very beginning who wanted to stay home and quarantine and be with their family and children who were out of schools. So I think one of our biggest challenges really was around capacity and burnout, being able to redirect and redeploy staff from, say, our dental programs and our education programs to our basic needs programs was phenomenal, in that staff were ready to jump into the front lines. I had dental assistants making lunches at our soup kitchen downtown, which was great, but it stretched us really thin. And I think that was really a big challenge for us. At the same time, while the community stepped up really nicely for us to provide in-kind donations such as food, and we had clothing donations and even financial donations that came in, we too saw an increase in contributions during that period of time. The challenge though was that we still were lacking general operating support. And that was really crucial to us, especially during COVID, trying to keep our lights on, keep the buildings open so our clients could come in, and even to pay some salaries for my administrative staff who were also working on the front lines doing intake with folks as they came in looking for employment and other things. So I'd say that while we had a lot of positives, those were our biggest challenges as we were trying to navigate COVID and try to keep our staff safe as much as possible, though they were on the front lines themselves. We also saw costs go up significantly in several areas as we were trying to do infection control on a daily basis and providing PPE to our staff to try to keep them safe while they were there. And as we've started to reintegrate volunteers into our programs, actually this week, as we're opening up some of our other program areas, we're continuing to be faced with that challenge of funding the new costs that we have associated with what we do. I say though, on the flip side, to answer your question around the greatest surprise or the positive element, it really brought us together as a team. People work with others that they had never worked with before, and it really solidified our motto that we are one band, one sound. And it really made us much more appreciative of the work that our social workers do on the front lines every day, that we as staff working in admin or working in education or health don't always see. and working through people's individual challenges to get to a place of self-sufficiency. And so it brought us together. It made us more present in our community, and the community more aware that we were there and that we were one of the few nonprofits that did not close our doors. And so that too was very helpful to raise awareness beyond our normal partners that we are here to help the Sea Island community as the largest nonprofit, but also help in the urban community of downtown Charleston.
That's terrific. One thing I'm curious about, and I'm going to ask the same question to everyone on the panel, is on average, what percentage of your giving is general operating support versus specific programs?
We have about 20% general operating and 80% program specific. And it's a challenge we've been trying to overcome for a couple of years now.
All right, terrific. Joe, the same questions for you. Would love to find out what's been the biggest challenge, but at the same time, what's been a great positive that's happened as well.
One of the challenges I didn't think that I would become is a software developer and website designer. And in all honesty, the requirements now for this digital age that we have to connect all of our folks together and being able to provide an accessibility channel, a tunnel for people, problem solve those issues. I had to train my staff, key volunteers to help with that as well, because every software developer that I knew, every web designer that I knew was already, all their time was booked already from other companies who wanted it for mass advertising. I need to get my message out there quick. And so I come to the table and say, can you donate, 15 hours on this? No, I can't. I'm way too busy. So I was working every weekend since May to learn how to do WordPress, word design, and working with our software developers in California to get some software launched in order to maximize efficiency and to really promote the access to service with our other nonprofit partners. So it's been quite a challenge doing that level of thing that I never signed up for. And then the reward from that, while that's happening, was when we instituted our self-care. An old motto of social workers is you can't help anybody till you help yourself. And my staff had never practiced that intentionally until I had to make it mandatory, that we have mandatory breaks throughout the day, that there's mandatory mindfulness training that we would have, and time for ourselves, quiet time, away from the kids. Many of my staff had kids at home and still do during this time. And so to be able to take time, to be able to refocus it, to see those rewards, and then to see, I have helped myself. I have 10 new volunteers that came up to me and said they want to do pantry deliveries now, and so seeing that change in struggling with the depression and anxiety, then to emerge from that as a stronger person while engaging our community and reactivating volunteers, getting them back into the flow, making calls. I mean, it's mind-blowing. So I would say that is the biggest reward, is seeing the impact right in front of me that way.
Absolutely. And the same, just as a follow-up question, for your nonprofit, for your budget in terms of annual gifts, about how much do you have that's general operating versus program specific?
It's almost exactly like Erica, 80-20, very program specific, very grant-based programs, and 20%, 80-20.
And I guess just to kind of sum up for everybody, and Kevin and Lily, you can raise your hands. Is that pretty accurate as far as a breakdown that you experience?
We're about 18.
Okay.
So we spend annual operating budget, about 20% of that is sustained by fundraising. And then we also do extraordinary fundraising for capital improvements and projects. But
Right.
About 20% of our budget is only possible through our fundraising.
Okay, terrific. Just going back, Kevin and then Lily. Kevin, I'd love to learn you gave us a lot of information, but really what you see as the biggest challenge, but also one of the biggest positives that you didn't expect to have happen during this time period.
I think for us, one of the biggest challenges was just to figure out what's the right business model to ensure that we sustain and stay in business throughout this really uncertain period. And with extraordinary expenses to care for the building, to care for animals, to maintain our programs, we knew we would have to cut. The temptation is not to cut as deeply as you need to, because you hate to sacrifice any element of your mission or programming. But on the converse side, there were some voices and some members of our board who justifiably challenged us to cut even deeper. And then the risk there becomes, if you cut too deeply, you're no longer serving the breadth of your mission. And for us, we would become simply an attraction. And that's not really who we are. So we fortunately landed, I think, at a middle ground that we expect to be able to sustain through next year. But again, as we forecast out, it's hard to know how long this will really persist and how long we'll be required to operate at a limited capacity with folks coming through our door. So that's the biggest challenge, is just constantly calibrating the information, the updates on vaccines, the updated tourism forecasts for next year, et cetera. I think the silver lining is similar to what the others have already shared, and it's the strength and resilience of our team that has become so apparent and obvious. We've always had a strong culture, but most of us have always been here in the building together, and now many of us are working remotely. And we've been able to sustain the culture through intentional efforts like trivia nights and book clubs and all staff meetings and happy hours. And our team wants to maintain that connection, even if it's virtually. So that's been very gratifying to see that spirit maintains.
That's terrific. Lily, would love to hear what's happening with Second Helpings.
Well, the challenge was that most of our volunteers that are on the trucks, that's 340 of them, are well over 65 years of age. So right away, we needed to let them know that it was okay not to volunteer on the trucks. So that was our biggest challenge. And one of the things I did is I wrote a grant and partnered with the furloughed restaurant workers to actually get on our trucks and help out. So and we received a grant to pay them. Of course, that unemployment thing kind of got in the way, but it really didn't, because the managers that were still working actually got on the trucks and used the funding to help their coworkers who were not working. So it was very positive. And then they ended up donating the money back to us. So it was like a win-win-win. So that was a challenge. The other challenge was I'm the only full-time staff person. Two of my coordinators who are part-time quit in the middle of this. One had to homeschool her children. The other one had identified heart issue and was not comfortable working. So they were great, though. They actually helped me select the new candidates, and we had it just flowed right. They started in 2 weeks, they trained them, and it all worked out. So that was a huge challenge. Being the only full-time staff person and 3 part-time staff people, we were already working on a playbook. So we had to finish our playbooks right away, so that if something happened to me and I got sick, some board member or another person could come in and do my job. So it's like all the history on every part of our programs, everything they needed to know is in the playbook. So now we have a playbook, they don't need me. So that's great. The biggest surprise was the fact that we all kept working, and we are all very dedicated to the mission of Second Helpings, and our board stepped up, and we recruited a lot of new volunteers. People after a couple months said, okay, I've had enough of this in the house. So we recruited younger volunteers, and we got a golf school in the volunteering for us. So that was very positive. So we've always wanted to recruit younger volunteers, and so that's happening now, and we can't wait to welcome back all of our volunteers.
That's terrific. Just inspirational hearing what each of you have done to show a lot of resilience and creativity to make sure that you're executing your mission during really challenging times. I want to just forward one question that we've received from one of our attendees, and wanted to find out about any successful approaches to increasing individual donations to support your mission that have been implemented. And this is from one of our attendees that would love to know this. So I was going to say, Erica, if you want to start, and then we'll just go around again. Would love to find out.
I think one thing COVID has stressed for us that we already knew, but I think it highlighted even more, was the importance of relationships. It was a lot about relationships that got us through those first few months whether it was staff relationships wanting to help out or community relationships. So when it came to our donors, because they're really strong believers in our mission, they too stepped up. And we used those relationships to be able to ask for the things that we were in dire need of, such as food or financial assistance, or even bread for our soup kitchen to make sandwiches. So through COVID, we have decided to focus more on how we're really diversifying how we manage those relationships. So it doesn't just have to be a phone call or face-to-face, but now we do Zoom check-ins with our donors. We actually make sure we're sending more notes and thank you cards and just things that help us show our donors we appreciate them during a time like COVID as well. So the new donor strategies for us have really been think beyond the physical and think about the virtual components, as well as making sure we show appreciation to our donors who have been with us. And for new donors who have come because they wanted to help due to COVID, we actually have a relationship management system in place where we actually walk them through different ways to be able to connect with us. We usually would do a physical tour pre-COVID, but with COVID, we're now moving to virtual tours of our campuses so that you can actually be with us and see what we're doing from the comforts of your living room. And that's where we've been able to use technology more efficiently to drive those relationships.
That's terrific. Kevin, would love to hear your response to the same question.
Yeah, I think, discovering the power of the virtual message through social media predominantly has been eye-opening, and being able to share our mission in ways traditionally we would, but embedding a direct appeal through those messages. And even our biologists and our educators who may have been a little shy in the past about making a direct solicitation or at least alluding to fundraising are very explicit now about what's at stake. And so that's been a wonderful outpouring of contributions as little as $5, which can really help and add up over time. And even events, we have an annual fundraising run and walk on the beach, which obviously we couldn't stage this year. Typically it would draw 850, 900 runners at a time. I learned yesterday, and we're doing it all virtually this year, encouraging people to run solo or walk with their families. We have 800 registrants. So we have almost the same volume of attendance, but it's all at a remove and remotely and safely. So it's possible in the connectivity even virtually.
Great. Lily, would love to hear about what you've seen as well.
Right from the start, because my background is in marketing, PR, and communication, I communicated constantly with our donors and our volunteers and our agencies that they got emails from me constantly. We are now doing a donor newsletter every month. We're doing a volunteer newsletter every month. I personally write out special thank yous to everybody who gives a gift. So our individual donations have gone up, and because hunger is a key passion of everybody. They don't want to see anyone go hungry. We actually met our annual budget by the end of July, but we anticipate that we're not going to continue to get those kind of donations. So we're going to be cutting our budget by 20%. So it's important that we manage that money really carefully, and most of it's restricted to COVID. So even though we might have made our annual budget, it's actually restricted funding. So we have to be careful with that. So we did do our annual event, but we did an annual event no-show. So we put out our Share the Bounties, our annual event, and we actually raised $50,000 through small donations. So that one was real successful because we didn't have to pay. Not happy, I'm sure the hotel is not happy, or the restaurants that was getting money from us, but we had no overhead. It was very inexpensive. We did it all electronically, and we're doing a lot of social marketing. I have 2 writers on my volunteers that are taking over social media. I have an intern that's doing YouTube, another intern, and both those interns are working on Giving Tuesday, and they're also creating an event that will kick off January 1st. It's virtual.
That's terrific. Joe, would love to hear about some approaches that you're using to increase individual donations and what's resonating in Georgetown and Horry County.
Yeah, I think it was, so it's interesting because marketing is probably the last thing that comes naturally to me because I'm a researcher at heart. And so when this first started happening, it was doing a community evaluation about what the needs are of our folks that we're serving. And our volunteer base. So it was a lot of interaction with those folks and it was really that missed opportunity of just connecting in general. I mean, we definitely heard the social isolation scale. We got, we use a survey tool to do that, administered by Boston College. And so taking all the research that we had, we really made a concerted effort to be as engaging with our base as possible. And what's interesting is that what came out of it was that adult education program that I mentioned, which was luck as well. So there was it really then connecting that, it brought us a new sphere of donors to launch that program exclusively, as well as to keep it self-sufficient. Whereas our other 3 programs are highly grant driven, this one is focused primarily and driven by donors and member participants in that program. And so it was really wonderful to kind of see, like, wow, this was a tremendous need in our community, and we were able to link it together using technology as best, you know, with the struggles, of course, involved with that. And so I would say really meeting that critical need based on the research that we had done from the beginning was really what got us that individual to.
That's terrific. Just kind of as a final question, because I'm mindful of our time, we've got about 8 minutes left, but I think this is key, and I'd love to hear from each of you is, you know, everything changes by the day, but what do you see as some of the biggest challenges your organization may be facing in the next 3, 6, 12 months? Because, you know, we don't, with most, you know, we're in hurricane land. We know when the storm's over. We don't know when this is going to end. And I'd love to hear what you see as some things you're really proactively concerned about, and you could share that with our donors. And Erica, if you want to start.
I think one of the things we are concerned about is donor fatigue. Our community stepped up tremendously in the beginning of COVID. We were able to closely almost meet our budget for the year. We did have to cancel 2 of our major fundraising events throughout the year because of COVID. But donor fatigue is a concern because at some point we're not sure if folks will be able to continue to give at the levels they've been able to give through these last 6 or 7 months. Stamina, I think about my staff and whether we'll be able to keep up the pace that we've been having to work at over the last 6 or 7 months. There's the usual pace of work, which is pretty high level for us, and you add COVID on top of that, and the everyday uncertainties of having to change or pivot or be fluid, as we've talked about. So that's really concerning for me as I think about stability of the organization. And so there's the money piece, there's the human piece, and then I don't know what's coming next. I don't know if our cases will go back up. We just had a staff person yesterday for the first time test positive. And so we've had to really rethink everything that we're doing and programs that we were just reopening as far as our education programs or our clothing room. We are now having to close them down again, not because of the case being positive, but more so because that affects my ability to have an adequate human capital to deliver on programs, because the people around that infected person have to also quarantine. So it's also the concern of what's coming next. Will we have hurricanes that hit? Will cases go back up? Will there be more upheaval as we go through to election day? All of those things I think about as far as how they will impact my staff and the organization overall. So every day I wake up ready and prepared to just adapt to what's next. And that can wear you out.
Yeah, very much so. Kevin, would love for you to share your thoughts as well.
Yeah, well, first of all, yes, everything that Erica just shared, it's so critical to think about the resilience of our team and their ability to carry forward it. With this extraordinary pressure for us, so many people removed from our workforce, we have people wearing 2 hats now. But I think looking beyond that and thinking about business recovery itself and on this cloud of COVID lists, the temptation would naturally be to flip a light switch and suddenly be back to doing everything that we were doing previously and resuming our plan. And we know we're not going to be able to do that. The economy will probably be slow to recover. We probably won't be able to bring back those folks that we have to lay off immediately. And we're going to have to be just very thoughtful and deliberate and cautious about how we step forward and make sure that we're critically examining the greatest needs in our community and those audiences that we serve. And they will have changed as well. So we need to be where the community and the public is, which is probably different than certainly last year. So.
Sure, absolutely. Lily, what do you see as, you know, we don't have a crystal ball, but would love to know what's on your mind for the next couple months.
Well, we've identified a number of churches, especially in Hampton County, and people, organizations that want to become one of our agencies. So we're going to have to expand our programs with less staff, you know, volunteers. So that's critical for us. And it's important that we serve those people. Right now, we can't give them perishable foods that we pick up from grocery stores. So we've initiated food drives and we're taking them non-perishable foods. So a lot of people have stepped up, and my goal is to educate the different communities on Hilton Head Island and in Bluffton and Beaufort that there is a need outside their geographic area. I mean, and I encourage give locally. That's something I tell people, you know, there's a lot of great national charities, but let's give where you live. So that's my motto. That's my theme to every one of my givers. And I'm driving that home because I really want to see that we have the money to continue our program. So that's really important to us, to make sure that we're meeting the needs of the people who are hungry.
Sure. Joe, would love to hear your thoughts also.
Yeah. Gosh, I've learned so much from everybody on this panel. So this is wonderful. I'm going to bring back a lot of this. And one of the things I'm seeing is probably being able to address the mental health disparities that we're seeing, which have always been here, in particular in our area with and our unemployment was the highest in all of South Carolina. And so, I mean, it's a nightmare out there. And then to be able to hire trained and qualified staff to be able to administer that. So I'm a licensed master social worker, but I can only do so much. And so to be able to have additional staff, you know, and additional funding to be able to address the critical mental health needs, suicide rates among seniors have skyrocketed in our area. It is, it's very sad. I mean, it's really, really difficult to talk with a volunteer who lost a client because they killed themselves. And one of the biggest challenges for us is to be able to address that. And it really hits close to home for a lot of our folks who go through that. And I think that challenge is going to be one that's going to be here for well beyond the 3 to 6 months. And I think that the COVID-19 virus has really brought out a lot of the mental health issues in our community. So I do see that, Melissa, as probably our #1 challenge that we're going to face as an organization.
Wow. Well, I just want to say, as we're almost at time, thank each of you so much for being so candid and open with what you're experiencing. I know this has been, I've learned a lot. I'm sure this has been great, insightful information for our donors who are participating. So very appreciative for what you do in our communities. For our donors who are participating, I just want to remind everyone this is being recorded. As follow-up, the slide presentation that we started with, we will be sending that to all of you following this call. In addition to those slides, the nonprofits that we're speaking with today are representative of many other nonprofits that are doing great work on the ground, and we actually asked some of the same questions to them. So we'll be sharing some of those responses in addition to the ones that you've heard live in this interactive, so you can have, you know, just an even more complete picture of what some of our organizations are experiencing on the ground. And then finally, after that, in about a day, because we always want to make sure that we're improving, is we will have a follow-up survey where we'd love to get your feedback on what we've done, because we have several of these programs coming up throughout the year and want to make sure that they're meeting your needs and we're being proactive in doing so. So with that, I'd really like to thank our panel. Thank you to our sponsor, Blackbaud, CEO Darren Goss for getting us started, and most importantly for all of our attendees for being part of this and for the work that you do in our communities as well. So thank you so much, and I hope you have a great day.
Take care.
All right. Thank you. Okay. And I think we will be closing.